Welcome to LA Currents. I'm Rasha Goel. November is Alzheimer's Awareness Month. 5.8 million Americans aged 65 or older are living with Alzheimer's dementia. To talk to us more about this disease is Dr. Helena Chui, Chair and Professor of Neurology at USC's Keck School of Medicine. She is internationally recognized for her research on Alzheimer's disease and vascular cognitive impairment. Thank you for joining us, Dr. Chui.
Thank you very much, Rasha, for the opportunity.
Absolutely. You know, this is a very important disease, and especially with this month and the number of growing cases. First of all, talk to us a little bit about Alzheimer's and what are some early symptoms that people should be looking out for?
Well, thank you. Alzheimer's disease is the most common cause for dementia as we get older. Dementia, I have to digress, is a big tent word, referring to a loss of memory and problem-solving ability greater than expected for normal aging. Alzheimer's disease is the most common cause for dementia. It's an example of a neurodegenerative condition where the nerve cells and the circuits in the brain that allow us to form memory and solve problems slowly fail. Alzheimer's disease is defined by a buildup of several misfolded proteins called plaques and tangles. And the plaques contain a protein called beta amyloid, and the tangles contain a misfolded protein called phosphorylated tau protein. The amyloid can build up very slowly over decades before there's symptoms. The brain is pretty resilient. But once the tangles start to occur, we see the early symptoms of Alzheimer's. The tangles start to affect the memory centers of the brain that we call the hippocampus. And one of the earliest signs of Alzheimer's is a difficulty in recording and retaining new information that we are experiencing.
So that's something people should look out for.
Yes, if we're all forgetful, we don't have, very few people have a photographic memory, so it's a little bit hard to know when we should worry about forgetting, because we all forget. But when we forget the things that are really important to us, or really the family notes a big change in our ability to remember. So things that are important to us are actually what's important in our finances or our appointments or celebrations. And if a person's having trouble remembering those things that are dear to them, it's an early warning sign. Now, there are many other causes of dementia. The second most common group are related to blood vessel disease, strokes. And then there's a third category that actually can be reversed, and they're related to the balance of hormones, the balance from the way our kidneys and lungs and heart function, and it could be side effects even from medications. So if a family member or person is noticing early signs of memory loss or more difficulty solving problems or remembering, it's really important to see a physician that's has expertise in figuring out what is the cause, so that a more specific treatment can be given. And some causes of dementia are treatable.
Would you say factors such as stress, race, and environment play a part in Alzheimer's?
Well, the stress certainly affects the quality of our life and sleep and blood pressure. So it's a little bit complicated. The most common risk factors for Alzheimer's are genetic, actually.
Really?
Yeah. And there's actually over 20 different genes that are associated with increased risk for Alzheimer's. And the risk strength varies. There's a few genes that are actually protective against Alzheimer's.
You know, this disease, it's so scary in a sense because they don't have a cure for it. So can it be completely prevented? I mean, now that you're even mentioning genetics to me, I just wonder, is there a way to completely prevent from getting Alzheimer's or dementia?
Well, okay, for dementia, yes, there's a way of completely preventing some of the causes of dementia. But so far, we do not have a way of preventing or curing Alzheimer's disease. It's something we're all, in the whole global scientific community, we're working on it. But we haven't yet broken the code for this category of neurodegenerative diseases that include Alzheimer's, Parkinson's disease, and its cousin Lewy body dementia, frontotemporal dementia, and amyotrophic lateral sclerosis, or Lou Gehrig's disease. We are intent on trying to break the code for that group. But there's a lot of things we can do to prevent stroke and vascular causes of dementia. And then there are many things we can do to actually cure or prevent these toxic metabolic causes.
Could you list one or two things when you say preventing vascular factors?
Yeah, well, the big high blood pressure, diabetes with high sugar, glucose, high cholesterol. Those we have really good lifestyle and medications to bring them into control. You know, stop smoking, that's a big risk factor, keeping weight in the ideal window, exercise, healthy diet. All of those things can protect the health of blood vessels and significantly reduce the risk of stroke and therefore damage from stroke to the neurons and their circuitry.
So to clarify for our audiences, then when we look at diseases like diabetes, heart disease, and strokes, these are contributing factors to Alzheimer's.
Well, it's a little bit confusing. They are definitely contributing factors for dementia, vascular dementia, one of the things I study, vascular cognitive impairment, due to stroke. They are definitely risk factors for stroke-related and vascular-related dementia. How they relate to Alzheimer's disease and plaques and tangles, the buildup of amyloid and tau, that's still controversial. So amyloid builds up and it has to be cleared from the brain through blood vessels. So having healthy blood vessels can help clear amyloid, which is the hallmark of Alzheimer's disease.
I see.
Okay, it's complicated.
It is complicated, but you're explaining it very well. You have done so much research and you continue to participate in research. Are you hopeful in the next few years? Because I read about numbers where they say they're staggering as far as the increase in Alzheimer's cases. Yet when we look at the past 10 years or even upcoming research, what do you foresee?
Well, I'm hopeful. Even this coming year, we have in front of the FDA, the Food and Drug Administration, a proposal to approve, a monoclonal antibody that's designed to help the body and the brain clear amyloid. It's that kind of research that makes me hopeful. We're not sure yet. It's still controversial whether that actually improves memory. It does help clear amyloid, that's pretty clear. But it's that kind of progress that makes me hopeful. Yes, you're right. We see a doubling of the number of people that have Alzheimer's disease and dementia writ large every 5 years after we hit 65. It's because probably with neurodegeneration and of the health of the blood vessels or hardening of the arteries, atherosclerosis, that the changes occur with time. So it's one of the prices we pay for living a little bit longer. We're still very happy we get every day, but every day these processes can start to accumulate. So it's a big factor that we have over 5 million Americans now with Alzheimer's disease and dementia, and expect it to go to 13 million in 2050, and we have 50 million cases of dementia in the world right now. So it's a huge challenge for us as human beings.
And speaking of cases, I was reading about how family members tend to get lost or they go missing, and there's still family members that are searching for their loved ones. What advice would you have on preventing this, or what can family members do to prevent another family member who has Alzheimer's from going missing?
Well, we have programs where, and GPS devices now that we can track. It's obviously heart-rending to not know where your mom or dad went and worry where they are out there alone and lost. And that's very true that in Alzheimer's, besides losing memory, we lose wayfinding. So when we talk to families, we always go over safety issues, like not everyone tends to wander, but a subgroup of people may have some restlessness and a wanderlust. And so there is, for example, a national safe return, we call it safe return program, that's run by the Alzheimer Association. And here in Los Angeles, we also have Alzheimer Los Angeles. And so these family-inspired and organized and funded organizations have helped with the national network. So even our police, there's a program where you can register. And there are many GPS-type advices, even that go in shoes to help us find our loved ones.
Oh, that's great to know.
Yeah.
So much research being done around this disease, and you are also involved in the Healthier Vessels, Healthier Brain Study research program. Tell me a little bit about this program.
Yeah. I'm a professor at USC, University of Southern California. We have one of 28 nationally funded NIA, Alzheimer's disease centers. Our center focuses uniquely on the role of blood vessel and their health and their relationship to Alzheimer's disease. So we are studying what we call the blood-brain barrier, which actually keeps the blood separate from the brain, keeps the brain kind of in a very clean and protected environment. And also we're interested in the blood-brain barrier, which is necessary to pull amyloid out of the brain and let it be cleared through the blood vessels. We're very interested in keeping blood vessels healthy by reducing the risk factors, high blood pressure and diabetes. I'm particularly interested with my colleagues in how diabetes affects the capillaries of the brain, which are really the smallest blood vessels where red blood cells have to go through in single file to give off the oxygen. The blood gives glucose to the brain and then takes the waste products from the brain out. So we're trying to understand better how diabetes and how it can damage the smallest blood vessels in the brain, the capillaries. We can't really see those with our CT scans or MRI, regular MRI scans, but we've developed a method at USC with my colleagues, Dr. Zlokovic and Dr. Montan, to use a contrast to look at leakage of the capillaries. This is a method akin to what the ophthalmologist does to look for leaky blood vessels in the retina in persons with diabetes. So at USC, we're developing new tools to look at the health of the smallest blood vessels.
So has this research not been done before? I guess I'd like to understand, how is this study different from previous research that's been done?
This is new. So, right now we have tools that can look at the major blood vessels, but it's new to be looking at the capillaries in the brain.
And is that your specific intention with this study? I mean, what are you hoping for with this study?
Yeah, so this is called an observational study where we're trying to learn more. We have another group of studies at USC which are called clinical trials, where we're looking at and testing new promising medications. So we have both types of studies going on at USC, including studies of those antibodies that I talked about earlier that are targeted to helping clear amyloid directly.
And with Healthier Vessels, Healthier Brain Study, you are looking for participants as well. So how can people sign up or find out more about this program?
Well, thank you. There's a brochure and there's a phone number for our recruiter, coordinator, Nadine Diaz. Her phone number is 213-821-7158.
Great. And you're currently accepting participants?
Yes, well, carefully and safely.
Okay.
So with the pandemic going on, we had a full stop to our observational studies. We kept our clinical trials going because it was very important that people taking these medications, investing, that they still be able to have access to the study medication. But we've restarted our observational study, with masking and spatial distancing and cleaning out all of our MRIs and PET scans and with safety precautions. We've started.
And how long is the study going to run?
Well,
so someone signs up. How long is the commitment
for them?
It's an
observational study. These changes occur slowly, so the study lasts 5 years. And we're trying to recruit 200 new people.
Great.
Especially ones who have mild diabetes and who are not taking insulin, so we can follow what the effects are on the smallest blood vessels in the brain. People come in, they get memory tests, an MRI scan of the brain with our protocol that looks at the smallest blood vessels. They get a PET scan to look for amyloid and tau. And we also ask if people are willing to have a spinal tap, which allows us to look at amyloid and tau proteins.
Okay. Well, we hope that people will sign up and get some more information from you. As we've been talking about Alzheimer's, I know when we think about this disease, it's constantly 65 and older. But there are people that have been diagnosed with Alzheimer's that are younger. What are your thoughts on that? And should people in their 30s and 40s start thinking about this disease and how to prevent it?
I mentioned that we've discovered over 20 different genes that are associated with an increased risk of Alzheimer's. There are 3 genes and mutations in those 3 genes that can increase the risk of Alzheimer's markedly. And unfortunately, then, the symptoms can start in the 30s and 40s. Fortunately, these are rare mutations, so it's less than 1% of all Alzheimer's. Persons with Alzheimer's have these autosomal dominant mutations. About half of people with Alzheimer's have another genetic risk factor called apolipoprotein E4, ApoE4 for short. And, for every gene, we have 2 copies. They're paired. One came from our mom, one came from our dad. And 1 copy of ApoE4 doubles the risk of Alzheimer's. Having 2 copies, fortunately, that's not very common, maybe 4% of the population.
But you have to get tested for that, right? I mean, how would I know I have this gene mutation?
Yeah, right. So we can order those tests as physicians, but we can get them through some of these 23andMe and Ancestry.com too.
Right.
That's another way to find out. But we do recommend that maybe talk to your physician so that the results can be explained, because it's a little bit complicated. The ApoE4 is not a cause. It doesn't mean you're going to get Alzheimer's disease, but it is a risk factor.
Right. And I bring it up because I just think that it's something that we should be aware about. It shouldn't be something that we should just think about, I'm going to wait till I'm in my 60s,
yes,
and then think about it. And that's why I brought that up.
Yeah, and so this is a very common risk factor, ApoE4. And what can we do? First of all, do we want to know if we have it? This is a discussion. I'm not going to say it's right or wrong. The medical profession at this point doesn't recommend widespread testing for ApoE4 because we're not sure yet what to do. If we have E4, we do believe certain things can reduce risk if we have E4, but we haven't proven it yet. And the things we think we should do anyway are basically the same. Having a healthy lifestyle, good exercise, aerobic exercise, 150 minutes of aerobic exercise every week, a good diet. If you have vascular risk factors, I mentioned high blood pressure, diabetes, high cholesterol, treating those with lifestyle and with medications if necessary. We recommend a Mediterranean diet.
Really?
Yeah, with more fish, which have high omega-3 fatty acids, which are healthy oils.
What if you're vegetarian or
osage.
vegan? A lot of people are going that route right now.
Yeah, so then actually nuts. Did you mention 4 almonds a day?
Yes, I eat 4 to 5 almonds a day,
Yes.
soaked and peeled.
Yes, and I have my can of walnuts and pecans. So nuts are nature's way of
So
giving healthy oils.
It's
Yes.
really about maintaining a healthy lifestyle,
It
you know,
is,
and
it is.
overall. It's
And,
not just
yeah.
about today or tomorrow.
And less red meat, which has less healthy oils and more inflammation associated. Don't have to cut it out entirely, but like you said, balance, good
Yes.
healthy lifestyle.
Do Alzheimer's patients live in the past?
Alzheimer's disease affects the memory center that allows us to record new memories. But there's a separate system where all the memories are stored and linked together. And those are more resilient. So a person who has Alzheimer's disease is going to experience kind of not able to lay out new memories, form new memories, but can still remember the things from the past. Hence, they are living where they have the memories in the past.
Or they'll remember a certain person, like a deceased wife or a deceased husband, saying, oh, I need to go do this with them, or I need to pick them up.
Yes, because that's what they're still able to remember. So actually a tip from one of my one of our research coordinators was for the family to understand that the person is not able to record new things, but to make that present moment good, go find where that person is and go to them. So that may be in their past, and so join them there.
Dr. Chui, for someone who wants to be a part of this study, what is the criteria?
We're looking for the healthier vessels, healthier brain for individuals who are over 60 and who have a diagnosis of early diabetes or pre-diabetes, who are not taking insulin and who are willing to be followed annually for about 5 years.
Great. You know, something else came to mind that I must ask you. So when we talk about symptoms and prevention, there's the common thing of, oh, I forgot where I put my glasses. Or my mother will come and say, I had to go get something in the garage. I forgot. Should we be concerned, or are those just typical aging factors?
Yeah, those are typical. We all experience that. Yeah, so it's like we have the medical student syndrome, and then we can have the TV syndrome. That
okay.
not to worry. So it's when it's repeated and when it's, if we're distractible and now in this day and age, we're on our cell phone and we're homeschooling and
then be concerned.
It's okay,
right?
yeah.
Okay. Because of the complexities of Alzheimer's, how do you encourage your patients to stay hopeful?
Stay hopeful.
Yes.
Yeah, so it's really important, I think, to think about us as a village and a community to go through this together. And we're there in our academic institutions like USC, UCLA, our family physicians, we're here for our families. We join as a village with our national partners like the Alzheimer's Association, Alzheimer's Los Angeles. We try to focus on quality of life. And so we talk about, I use the mnemonic, SPAM. That itself is not a healthy food, but safety. S, safety. P, present moment. Make the present moment safe and pleasant. Make it a quality moment, and the family can help with that. A, for staying active physically. Walking is actually good as long as you do it for enough time.
Right.
And meaningfulness. We all want to have want to make some difference, be part of a community, be contributing, be appreciated. So it's our family and our friends. So those are the 4 things we focus on. We also talk about the care provider, the family member, because it is a team effort.
And it could be taxing. I was going to ask you about that. I mean, I think being a caregiver
one
could
of
be
the
taxing
first books,
mentally and physically.
And one of the first books that was written was the 36-hour day, you know.
Wow.
So, you know, it can be more than 24/7. So we need the caregiver to know that they don't have to be the one on call all the time. So we help plan, you know, we have to set up a plan and different people that can fill in. So
is that the advice you'd give to them, to a caregiver?
Yeah, so what we do at in our clinic, our memory clinic, is, you know, we focus on making the accurate diagnosis, the best possible treatment, focus our attention on the quality of life for the individual and the care provider and the extended team. We have to do that not only for what's in front of us now, but long-term planning. So, and we do really appreciate our partners in this, our social workers, physical therapists, occupational therapists, the Alzheimer Association, Alzheimer Los Angeles.
Well, as you said, it takes a village.
Yes.
So, and we've just got to keep moving forward. So, Dr. Chui, thank you so much for taking the time to come down here and talk to us about this disease. And again, with the Healthier Vessels, Healthier Brain study, we did provide the information. If you are interested, please do look into that study. And once again, thank you, Dr. Chui. November is Alzheimer's Awareness Month. Thank you all for joining us today. I'm Rasha Goel with LA Currents.